Okay, so I was told by a viewer that it would be better if they could see that I was a real person. So while still trying to maintain my anonymity, this is my solution. Hope it makes some people happy. Today we're going to talk about amplifiers, receiver amplifiers, and amplified receiver grounds. We are the ones who suffer from depression, clinical depression, bipolar, mania, schizophrenia. We suffer from these bullshit terminologies because mainstream psychology doesn't seem to understand that the subconscious works like a radio wave. We, as receivers and amplified receivers, are constantly being bombarded by the subconscious brain waves of others. Most of the time, transmitters, amplified transmitters, battery transmitters, etc. So, with that knowledge, knowing that it is not your brain malfunctioning, it is your subconscious brain receiving the negative brain waves from the transmitters. Most of the time, we get the negative because the subconscious is constantly trying to rid itself of those negative thoughts, emotions, um, those brainwave patterns. As receivers, it is very difficult, if not impossible, for us to transmit those emotions, those thought patterns, those subconscious brainwaves to somebody else because we are receivers. That's what our brain is wired to do. If you suffer from depression, clinical depression, mania, bipolar, uh, schizophrenia, you are a receiver. If you suffer from schizophrenia, most of the time you are an amplified receiver ground. And those subconscious brainwaves from others invade your brain, and it is very difficult without practice and knowledge of what's going on to separate yourself between what you are receiving and what is honestly you. And without the knowledge and the skill and the training, your brain is wired so that you appear crazy. You feel that you're crazy. Um, this is not the case. This is why I'm putting out these videos. I'm trying to help you guys and let you guys know that this knowledge has been suppressed or lost for who knows how many years. I'm guessing 300-400 years. Um, but don't ask me how I got it. I don't know. I wish I knew. If I knew, I'd be a lot happier. But that's what's going on. That's why you're depressed. Um, Everyday average people, batteries and battery transmitters, they don't feel the same kind of depression we do. They don't suffer the same kind of psychological and emotional trauma that we do. If you are a receiver and you've been told that you're clinically depressed and they want to give you all these drugs, and the drugs are supposed to help you cope with everything going on in your life, bullshit. What's going on is that your brain, your subconscious brain, is receiving the transmitted emotional and psychological brain waves from others, most likely transmitters or amplified transmitters. Battery transmitters are usually the worst because their subconscious works in a one-way pattern. Those are the ultimately selfish people who try and dictate your life, who like to bark orders, who like to be in control. Battery transmitters are very, very selfish people. Um, they have no regard, if any, for the emotional health, well being, physical health, or well being of others. And when you try and talk to them, you get the deer in the headlights look like they don't know what you're talking about. That's because they're a transmitter. but we're talking about receivers. I'm an amplified receiver. I suffer greatly from emotional trauma from others. I have depression. I've been told I have clinical depression. I've never taken any of the drugs that they've recommended me take because I don't like drugs and I don't like chemicals, especially man-made chemicals. There are some drugs out there, marijuana, what's that, peyote, the South American cactus plants that you take that provide brainwave altering effects so that you can look within. Those are okay, but I would not advise taking those on a regular basis because they will do things to your brain that you don't have any control over because you don't know what you're doing. You don't know what's going on. But maybe with some information, maybe with this information, it will help. So, as a receiver, if you have been told that you suffer from depression, you have horrifying thoughts and brainwave patterns and dreams, and you space out, and when you come back, you're terribly sad. That's because you're a receiver. Okay. Uh, Once again, if you're an amplified receiver ground, you probably suffer from schizophrenia, which is basically you hear voices. You have different personalities come out that your family and friends don't recognize. That's because you are receiving the transmitted information, the subconscious, emotional, and psychological brain waves from others. And without the knowledge to know what's going on, you don't know how to handle it. And it becomes an issue that most people try to solve with drugs. Once again, stay off the drugs. Use this information, practice disengaging and detaching from those brainwave patterns, okay? You have to stop what you're doing and mentally, in your head, tell yourself, detach. In your head, see like a plug unplugging, see a picture tearing apart, see something that will give you the reference that you are trying to disengage from those thought wave patterns that are not yours. They're somebody else's. But because you are a receiver, it feels like your own. It feels like your emotional trauma, your sadness, your depression. Okay, it's not. It's because of the way that your subconscious is wired. Okay, now some of you might be thinking, well, is there a way to rewire your subconscious brain? Not very safely. Um, I wouldn't advise it. What I would advise is teaching yourself what's going on, teaching yourself how to detach and disengage from those emotional and subconscious brainwaves that you are receiving. It's not impossible. It takes practice, but you can do it. Okay, so once again, in closing, if you suffer from depression, clinical depression, bipolar, mania, schizophrenia, etc., you are a receiver, most likely an amplified receiver, because if it affects your overall health and your well being, it is because you are an amplified receiver. Regular receivers and receiver grounds usually have a pretty good hold on what's going on in their head, and they can maintain the face, the facade that they're okay, um, with not too much difficulty. Sometimes it's overwhelming, but if you've ever been prescribed drugs for depression, yeah, you're an amplified receiver. Okay, so use this information, practice disengaging, detaching from those brainwave patterns that you are receiving subconsciously, and you will find that you will find yourself again. And being yourself is awesome. Okay, so Have a good one. Hopefully this will help, and I'll make another video later. Thanks.